This is a piece of work that we've commenced just during COVID, but with a partner organisation who we've actually worked with for the last 4 years, a company called Health Navigator. The current piece of work, the COVID piece of work, was set up to provide psychological support for people who are isolated, and particularly the shielded group of patients or people with long-term conditions during COVID. We recognised fairly quickly that we had a number of patients who had significant health conditions who were not able to access normal services, were going to be relatively isolated, and potentially great for them in terms of risk, but also maybe unnecessary and put additional strain on urgent care and hospital services. Health coaches are basically they're nurses in effect, nursing background. They have been trained specifically for this role. IAPT is the sort of broad name for this sort of psychological behavioural approach that's used now quite widely across the NHS. And so that's the sort of, I guess, the basis of the health coaching in these programs. Building patient resilience, but using that as a tool for a system benefit in terms of better use of local resources and patient benefit in terms of improved well-being for the patient. So everybody hopefully wins from this piece of work. The current piece of work we're right in the middle of, and whilst it will go through the same level of analysis, we don't have that yet. So what we do have is some anecdotal reports from patients about saying that they felt supported, saying that they valued the input of the health coach. That will need and will go through a more formal and more rigorous evaluation to see exactly what the outcomes were. But it'll take some time for that to happen.